I would like to thank the scientific committee for inviting me to be the pioneer lecturer this year, probably with some input from a certain ex-president. Some of my registrars previously have given this lecture, but I have a few more pearls of wisdom that they didn't have. I attended the newly established clinical school of the St George Hospital, which was established in 1963, from 1964 to 1966. This was the first contact with Associate Professor of Medicine Jim McRae and Senior Lecturer in Medicine John Morris of Sydney Medical School. The superintendent of the hospital was Frank Broderick, and that name would be familiar to a lot of you, as he's the father of a previous sex discrimination commissioner, Elizabeth Broderick. The significance of these physicians were important in my future choice of nuclear medicine as my specialty. This photograph of Jim McRae was taken from the yearbook of yearbook of medicine in 1966, and he was a Sydney graduate with honours, and he was sent to Berkeley campus of the University of California by Professor Blackburn, where he gained his PhD in physics. He was a very fine clinician, and people came on weekends for his ward rounds on Saturdays at St George. I was a student for 3 years, intern and senior resident at St George. It was during these 3 years that I became exposed to the new specialty of radioisotopes in medicine. Jim McRae had established it in the medical school at the University of Sydney, adjacent to RPAH campus, encouraged by Professor Blackburn. This has also been lifted from the yearbook of the class of 1966. The quote, "Alice in Wonderland," is significant. John took us for case presentations, which he demanded exact details, and if you fumbled your way through a case, he'd say, yell out at you, "Who do you think? Where do you think this is, McLaughlin? What, Alice in Wonderland?" So everyone was always on their toes presenting cases to John Morris, who was also our second student supervisor at St George. He established a nuclear medicine department at RPA in 1962 or 3. A small department was established at St George with the encouragement of McRae, Morris and the interest of Broderick. Hence, this was my first contact interest with the specialty. Morris and Broderick were later leading figures in establishing the ANZ-SNM and the ANZ Association of Physicians in Nuclear Medicine, now the AANNMS. Towards the end of the senior RMO year, One has to make the decision of what to specialise in the next year: paediatrics, anaesthetics, internal medicine and so forth. I decided on nuclear medicine and contacted John Morris at RPAH Pie Factory, formerly Scott's Pies Factory for making meat pies. I got the registrar job for 1969. It was a shock when I got there to find a very small, cramped building with little or no privacy for the patients. Some years later, an extension was added to the relief of all the staff and the patients. St George was the source of a number of trainee registrars in nuclear medicine at RPA. The first, in 1968, was Tony Walker, who was a medical registrar at St George. 1969, myself and Fred Lomas were registrars. Fred was a year ahead of me in medical school. He was at the time a clinical research ward registrar at RPA. In 1971, Ern Crocker joined us. He was a student at the clinical school, which was now under the auspices of the University of New South Wales at St George. The very first registrar at PA was Millicent Marion from Adelaide. Overseas training was very important and expected of all trainees then and subsequently at Prince Alfred. Tony Walker trained at Johns Hopkins University in Baltimore. He stayed in the US and worked in Milwaukee for many years. Fred Lomas also went to Hopkins, which was directed by Henry N. Wagner Jr., and he wrote the first textbook of nuclear medicine. Peter Bork went to the University of California at Berkeley, home of Hal Anger, the inventor of the gamma camera. He never returned to Australia, working in San Francisco in an MRI practice. Tragically, he died of lung cancer. I went to the University of Chicago's Argonne Cancer Research Hospital in 1972 to 1973. Ern Crocker went to the University of Pennsylvania, Philadelphia, David Cool's department, and the inventor of emission tomography, the forerunner of transmission CT. Overseas training continued for many years, not only from RPA, but RPA's contribution was vast. Roger Uren, Harvard; Mike Yates, upstate New York; Monica Rossley, Memorial Sloan Kettering; Barry Flynn, Harvard; Patrick Butler and Richard Quinn, Columbia Presbyterian; Paul Roach, Harvard; Robert Harmon Giles, Hospital for Sick Children, Toronto; Andrew Southey, also Harvard; Kevin Allman, University of Michigan, Ann Arbor; Ken Lee, a Victorian who did a year at PA as a registrar, went to Washington University, St. Louis. Kian Lee went to the University of Michigan. John Chew and Sharon Puzzle, prior to PA, were trained at Royal Marsden Hospital in the UK. Sadly, and to their detriment, overseas training ceased many years ago, probably due to incorporation of radiology and nuclear medicine. This was also lifted from the yearbook in 1966. You know John Morris on the left, On the right was Professor Blackburn. We used to call him CRB squared for short. It's interesting, he only died a few years ago, a few months short of his 104th birthday. In early 1972, I travelled to the US to take up an appointment of visiting fellow and scientist at the Argonne Cancer Research Hospital at the University of Chicago. My supervisor was Paul B. Harper, director of the ACH Research Cyclotron. Harper was also professor of surgery at Billings Hospital, the clinical medical centre of the university. He was also on the active on-call roster of the Department of Surgery, a truly remarkable man. Chicago at the time was the epicentre of US nuclear medicine personnel and research. Alex Gottschalk, head of radiology, deceased. Paul Hoffer, head of nuclear medicine, also deceased. James Quinn was director of nuclear medicine at Northwestern University and editor of the Yearbook of Nuclear Medicine, later taken over by Paul Hoffer. He's also deceased. Jim Conway is Director of Nuclear Medicine at Chicago Children's Hospital at Northwestern University. Robert Henchmen is still active in nuclear medicine at Loyola University Hospital in Chicago. I worked in the basement of ACRH, where the cyclotron was housed, as well as the laboratory and Harper's office. It was in this lab that the complex, capricious technetium-99M's chemistry was solved, leading to technetium pertechnetate for brain scanning and technetium sulfur colloid for liver scanning. There is a little anecdote to the sulfur colloid. The first patient, in inverted commas, to receive a dose was Paul Harper, and they scanned him up in the hospital with a gamma camera, and there was a photopenic circular hole in the middle of his liver, and this caused a whole stir in the department, and everyone was worried, and Harper knew there was something wrong. Anyway, fortunately it turned out to be a dead PM tube. Harper and team were also interested in the potential of cyclotron-produced, very short half-life biological radionuclides, nitrogen, oxygen and carbon, for labelling physiological molecules. The half-lives of 10, 2 and 20 minutes respectively are rounded off. Because of the half-lives, performing well counting of small animals, mice, rats and guinea pigs, organ distribution studies of percentage of injected dose per gram of tissue was very tricky indeed and required great coordination between a team of people counting the clock and changing the tubes. I was very privileged to be part of the cutting edge of the fledgling beginning of positron imaging and the first myocardial perfusion studies at rest. Nitrogen-13 ammonia was synthesized to test its feasibility for myocardial perfusion imaging. The basis of the theory to use this was ammonia, in this case N3 ammonia, is an essential substrate for the synthesis of myocyte glutamate. Hence, many mouse biodistribution studies were performed to demonstrate high uptake by mouse myocardium. To further confirm this, the organ distribution studies were repeated on mice after being administered a glutamate synthase inhibitor to prove it blocked mouse myocyte synthesis of labile glutamate. And as you'd predict, there was no uptake of labile glutamate. Imaging was the next problem to solve, of course, as nitrogen-13 was a positron emitter, and there were no positron imaging devices then. With the help of the physicists in the clinical department, led by Bob Beck, whom Dale Bailey would know, a conventional nuclear Chicago anger camera was adapted. Firstly, they built a tungsten collimator by drilling holes in sheets with many diamond-tipped bits, which must have cost a fortune. The sheets were glued together to create long parallel holes for planar imaging. Secondly, the camera was adapted from a stationary device to a mobile one by attaching 4 pneumatic wheels. It was towed by a golf cart to travel in hospital corridors and elevators to the cardiology department exercise laboratory. This is where the first N13 ammonia myocardial perfusion studies were performed, with a honeycomb pattern of the collimator overlying the images. Rest images only were produced. I was part of this team and a co-author of the report of this work, basic laboratory workups and clinical, which was published in Radiology by Harper in 1973, and the reference is there. This paper held the record of the most number of authors at the time, noted by Jim Quinn in the 1973 Yearbook of Nuclear Medicine. This is a time activity curve of a blood sample from a volunteer who's had an injection of N13 ammonia. There was very rapid clearance from the circulating blood. Now these were groups of images were taken with this system. The first one at the top left was a normal study. You'll notice that there was lung uptake and myocardial uptake, and over a short period of time the lungs cleared and the liver became prominent. You can see these were anterior views, and you could clearly see the myocardium. The series of images below were taken of a patient who was a very heavy smoker. You'll note that the lung uptake of ammonia took a long time to clear, and it doesn't clear completely, and it overshadows some of the uptake of the myocardium. The group of images on the right are 3 different patients with infarcts. You can see clearly the infarct in patient A in the inferior wall, and a smaller infarct in patient B, with a smaller infarct, and in patient 3 a clear infarct in the apical inferior wall. Unfortunately, patient C died 2 weeks later, and at autopsy that defect corresponded exactly with the infarct. In the October of '72, while I was at the University of Chicago, I travelled to Monte Carlo with Alex Gottschalk and Paul Harper to the International Atomic Energy Agency Nuclear Medicine Conference, which they sponsored in those days, to present a paper on renal imaging. They supported these conferences biannually every 2 years for a number of years before they were discontinued. This photo was taken on the middle winding road from Nice to Monte Carlo by the French taxi driver, the vehicle you see on your left, on the 22nd of October 1972. Note the fashion of the time. I had long hair, boots, a paisley tie, a broad belt, and a pipe. This was before bell-bottom trousers came into fashion. Paul Harper also had a pipe. Unfortunately, both Alex and Paul are also deceased. 1972 was a dramatic year for many events, locally and worldwide. It was Richard Nixon's re-election year. It was the year of the Watergate Hotel break-in of the Democratic Party headquarters by Nixon's henchmen, Ehrlichman and Haldeman. The Munich Olympics were on, and the kidnapping of the Israeli athletes by terrorists, killing 7 of them. But it was the height of the Vietnam War. The Allies mined Haiphong Harbour to prevent VC ships entering. There was blanket bombing of Hanoi. The Chicago 7, originally 8, led by A.B. Hoffman and Reen Davis et al., invaded the Republican Party re-election convention in Chicago, causing a massive riot with many arrests. The interesting thing was that A.B. Hoffman and Reen Davis became model citizens later in their life. The clinical department of nuclear medicine of the University of Chicago was in Billings Hospital. It had monthly lunchtime talks for visiting speakers from mainly other Chicago University Hospital nuclear medicine departments. This gave me the idea to have similar meetings in Sydney, which I set up with the help of other physicians on returning to RPA. And this is published in the autumn edition of the Gamma Gazette last year, the history of nuclear medicine, the history of the New South Wales branch of the ANZ SNM. The University of Chicago was famous for being part of the Manhattan Project, the development of the atom bomb. It was led by Enrico Fermi's team. They built and activated the first controlled chain reaction on the floor of the squash court under the western stand of Stagg football field, which now is demolished, for which he won the Nobel Prize in Nuclear Studies. The university has had many Nobel Prize laureates. Example, Milton Friedman, economics, and the famous alumni such as the 44th President of the United States, Barack Obama. I returned to the pie factory, RPA, in mid-1973 as a staff specialist, and a few years later as a senior staff specialist. I was responsible for the clinical service, supervision and training of registrars, organising the weekly in-house seminar presentations and interesting cases. Often there would be a presentation from one of the senior staff specialists from other departments like haematology. There were over 30 registrars changed during my time at RPA up to 1993, many of whom went on to become heads of departments. During these years there were developments in other methods of imaging. All was said by others to herald the future demise of nuclear medicine. First in the early 70s was grayscale ultrasound at the Australian Acoustic Laboratory by George Kossoff and his team. They provided a course for a diploma in diagnostic ultrasound in conjunction with Bill Garrett at the Royal Hospital for Women. A number of nuclear medicine physicians acquired the DDU, and we installed an ultrasound machine at PA in the department, operated by John Hughes, Sharon Puzzle, Roger Wren and myself. No sonographers. Problem solved. The next threat, also in the early 70s, was the EMI scanner. It was a CT scanner. The only significant loss was the many brain scans, except those for suspected inflammation and or infection from the Children's Hospital, which our department covered till they acquired their own department when Bob Giles returned from training at Toronto Hospital for Sick Children. The next serious threat was the development of brain MRI in the late 70s. This was further developed to image all other organs and soft tissues of the limbs, especially joints. However, it can't image cortical bone, but nuclear medicine bone scans thrive on it. So we still survive with the development of SPECT-CT hybrid imaging and its increased specificity to near 100%, and development of agents for PET-CT imaging that specifically locate at the site of the disease and were designed to detect. It is irreplaceable and literally imaging atoms. Another major advance was the medical cyclotron. John Morris, through his contacts in the federal government, negotiated the purchase of a cyclotron and a PET scanner. The decision by the federal government was made in 1986, and the $20 million complex to house the cyclotron was completed in 1991 and sited at RPA and operated by ANSTO. The first PET scanner was installed in 1992. Not only short-lived neutron-deficient radionuclides were to be produced, but longer lived ones as well. For example, radioiodine 123, gallium 67, and thallium 201, etc. could be synthesized. A new word has come into the vocabulary: theranostics. This is not a new area in nuclear medicine, only the name is. It's been around for 80 years. The year of 2017 was the 75th anniversary of Dr. Stawell Saul Hertz of Mass General Hospital in Boston using radioiodine 131 to treat a patient with thyroid disease in January 1941. It subsequently has been universally used in children, adolescents and adults. The only contraindication, of course, is pregnancy. The vast database accumulated over the years had shown there is no increased incidence of cancer of any organ or leukemia. However, I researched this a bit. The American Thyroid Association in 2019 published an NCI, National Cancer Institute study of a cohort of 19,000 from 1946 to 1964, showed a 12% increased risk of breast cancer, as women mostly get thyroid disease, and considered together with other tumours, it was a relative risk of lowered to 5%. This surprised me, and it would be a good idea for you all to look this up. However, it is still very safe treatment of Graves' disease, unlike surgery, even in the best of hands. Surgery is mostly confined to patients with thyroid cancer. The new therapies like lutetium-177 or other radionuclides tagged to specific antibodies, example PMSA, are showing real promise without the systemic side effects of chemotherapy and the localized ones of external beam irradiation. My career has seen the development of all the advances in nuclear medicine, which has survived many threats by other modalities. Just changing the subject, I've never been an office bearer of the ANZSNN. However, I was an office bearer of the Association of Physicians in Nuclear Medicine, now the Australasian Association of Nuclear Medicine Specialists, for 8 years, from member of council to ex officio president. The major issue of those 8 years was insisting radiologists undergo more than 1 year's training in nuclear medicine as their college proposed. It was eventually settled at 2 years. I was present for the 50th anniversary of the Royal Australasian College of Physicians and represented our specialty at the special functions. This is a list of former presidents, and there's two in this photograph of John Morris and myself at the door to the biofactory on Salisbury Road at Camperdown. The windows in the back were the windows of the animal house, which we used to use regularly over the road in Salisbury Road. The second president sadly passed away, Michael Quinlan, just recently. He was a very nice man and a very good physician, sadly. This is another photo, also lifted from a book commemorating the college and towards knowledge. And this is Frank Broderick on the left and Prover Murray on the right, also deceased. They were both presidents of the association too. Thank you for your attention.